Hey y'all, it's Michaela with Hospicenursebasics, and today we're going to go over more detailed similarities of hospice versus palliative care. And the reason for that is because I just keep getting more questions and I love it. So I definitely want to do another video. I think the story time video was great to kind of paint the picture, but let's just kind of talk about it and get more detailed into the actual services themselves. Stay tuned. I hope you guys enjoy this video. Like, share, and subscribe. Let's get into it. So we know that both programs want to provide comfort care to patients with terminal life-limiting illnesses. But how do they differ? So let's take a patient with COPD. We know that COPD is a terminal condition because it does not have a fix or a cure, but it can be managed. So just because a person has a diagnosis of COPD does not qualify them for hospice care. Now, it will qualify the person for palliative care because palliative care can be used at any time during the illness. But hospice care is not utilized until that COPD patient has reached the end stages of the illness. So you have to keep in mind that just because someone has COPD does not mean that they're passing away. People with COPD can live for a long time, very long time, especially depending on their lifestyle, how compliant they are with medications, and how they respond to treatment. Patients with COPD can live for years. However, if the patient needs symptom management and if their goal is to maintain a certain quality of life, then they may be appropriate for palliative care. Palliative care is here to provide comfort care to those that are trying to maintain their quality of life, while hospice care is here to ensure quality of life for those who are at the end of life. That's the difference. So a good way that I try to remember is hospice is at the end stages where we meet that 6 months or less prognosis, and palliative care can be used at any time. Anytime during that illness, a patient will qualify for palliative care. Okay, y'all, so we know that both programs manage symptoms and provide comfort care, but the approach is different. So let's think about a cancer patient, someone that's doing chemotherapy, someone that's had radiation. That patient is more appropriate for palliative care because they're still being aggressive. They're still doing aggressive treatment. So the hospice care team is able to come in, provide education to the patient and family, and to make sure that they're still maintaining a great quality of life. However, for the patient that has done all the chemo, they've tried the radiation, they've had surgeries, but no matter what they do or despite all treatment measures, the cancer continues to progress, unfortunately. That is when a patient is referred to hospice care. Usually the doctor, or the specialist rather, would refer the hospice patient back to their primary care doctor or refer them just to a hospice company so that they can receive end-of-life care and end-of-life benefits as they begin to transition into the next stages. So a really good similarity between the two programs is that they both allow the patient to have their symptoms managed at the comfort of their home. So this means the patient does not have to go out. They don't have to make an appointment and sit in the doctor's office or at the clinic or anywhere like that. When something happens, the nurse comes to them. Also, physicians love hospice and palliative care as well because it gives them extra eyes and ears on their patient. So if something happens, the palliative care nurse or hospice nurse will call the doctor, the referring doctor, and give them an update on how the patient's doing. They will also receive guidance on how to treat symptoms from their doctor. And this way the doctor can still be in the loop and be a part of the patient's care. So both programs, they will provide additional support and resources for the patient and family, but the resources may vary per program. Let's just start there. So we know that hospice care is able to provide like medical supplies, toiletry supplies, durable medical equipment like oxygen concentrators, hospital beds, again, like I said, wound care supplies, toiletry like wipes or gloves, chucks, briefs, things like that. But the palliative care program may not. Now, again, it's important to know that Medicare has not regulated palliative care. So a hospice company may design a palliative care program as they see fit. Some palliative care programs would supplement supplies or may provide a hospital bed, but not all of them. Another difference is palliative care, from my experience, may only offer nurse practitioner visits one time a month. That is their routine visit or as needed. But with hospice care, there's many different levels of care. You have routine visits where you get visits from the nurse and the chaplain, the social worker, the bath aide. They also have a program called respite care where you get 5 days of inpatient care covered at no out-of-pocket cost to you at the time. Hospice care also has what's called general inpatient care. So general inpatient is used when there's a medical crisis, for example, maybe pain that's not being managed at home. So the patient requires more maybe IV pain medications that we're not able to do at home. So if that's the case, hospice will provide transportation to a medical facility that will get the patient's symptoms under control. And then once the patient stabilizes, the patient is sent back home. So usually general inpatient is a short-term stay. However, if there is a medical crisis that can be managed at home, but they may just need a hospice team member to stay there with them continuously, then the hospice benefit also provides what's called continuous care. And once the patient's symptoms are managed and they become stable, then continuous care can stop. However, these levels of care are only provided under hospice, not palliative care. Okay, y'all, let's talk about on-call, because we know that hospice provides emergency on-call visits for their patients 24/7. However, for palliative care, it could be different. And I'm just going to tell you guys from my experience. If there's an emergency situation for a hospice patient at 2 a.m., they will receive a visit from the hospice team member, no matter what. If there's something going on and it's an emergency, hospice is on the way. But for palliative care, if there's an emergency at 2 a.m., from my experience, they may be recommended to call 911 or to call their doctor the next morning, or they can make an appointment to see the nurse practitioner, the palliative care nurse practitioner. But the only time hospice makes a visit for palliative care patients is if that palliative care patient is ready to sign up and transition to hospice care. Okay, so now we're going to talk about the different disciplines that will visit the hospice patient and the disciplines that visit the palliative care patients. Now, I think I mentioned this earlier, but for a palliative care patient, they typically will receive one nursing visit from a nurse practitioner once a month. And I have seen other programs that will still offer the chaplain and social worker and even a home health aide to their palliative care patients, but they may not visit as frequently as they do as for hospice care patients. Now, for hospice, they have a nurse, a home health aide, a chaplain, a social worker, a volunteer, and those disciplines can visit as often as needed, as long as the patient's needs are being met. So if they need a nursing visit daily or a home health aide visit daily, hospice can accommodate that service if it's needed. Okay, so let's just talk about therapy in hospice patients and palliative care patients, because I don't know how many times I've heard that just because a patient is on hospice care or on palliative care that they are not allowed to have therapy services. And that's not true. Medicare allows hospice patients to have therapy if it's needed. And again, like I told you guys earlier, Medicare hasn't regulated palliative care yet, but I don't see how a hospice program can offer palliative care and not allow a patient to seek therapy as well. And I'm gonna tell you my reason behind that. Okay, so in the beginning, we spoke about how a palliative care patient wants to maintain quality of life. So with that being said, why wouldn't we offer therapy? Especially if we start to see things like trouble swallowing or they're becoming weaker. Safety may be a concern. Let's offer therapy services to allow this patient to be as independent as possible for as long as possible, if that's their goal. Now, even for hospice patients, there's been times where we may need to have therapy services. If they start to show signs of difficulty swallowing, or the patient caregiver may need assistance with making home modifications, we can offer therapy services because Medicare does allow it for hospice patients. So we should be definitely utilizing it. So another question that I am asked often is, how long can a patient stay on hospice and how long can a patient stay on palliative care? And that's a really good question. Now, what I can say is that with both programs, the medical director or certifying physician has to say and recertify the patient and say that the patient still qualifies for the service. So for hospice, every 90 days for the first 6 months, they're recertified for services, and then every 60 days continuing until they discharge. I've seen hospice patients on hospice for years because the medical director or certifying physician still feels that they meet hospice qualifications. Now, for the palliative care patients, we typically like to look at transitioning those patients to hospice care. I would say maybe after 6 months to a year of being on palliative care. Now, again, just like with hospice, they have to be recertified by the medical director who still feels that they're appropriate to continue to be on palliative care. But from my experience, after 6 months or a year, the palliative care team will come together and say, how is the patient's health at this time? Are they still appropriate for palliative care? What are their goals? Would they benefit for something like home health care? Or are we at the time, or have they progressed enough within the health condition that it may be time to transition to hospice care? Or has the health condition stabilized? Okay, guys, so those are some of the similarities and differences that I share with patients and their families when I go to meet with them to discuss hospice and palliative care. But I know there's more. So if you have anything additional to add, please leave a comment, and I would be just thrilled to hear about it because I know every program is different. I hope you all enjoyed this video. Please like, share, and subscribe, and I'll see you guys in the next one.